Where are we with COVID-19 testing? Who's getting the tests? Do we have the needed tests and materials to get a true sense of how many people in our community have it? And lastly, what's the turnaround time to get results from the tests that are being conducted?
Well, thanks, Deborah, for that question. And testing is a hot topic. And I will start by saying that we are not where we would like to be. We are in many ways behind in terms of testing. If there was a way we could have tested far more people by now, that most certainly would have been the path that I would have chosen. That being said, here we are. We've got to do the best that we can. We are testing in this community right now between 100 and 150 people a day, which again is not enough. But we are testing those individuals for whom the result will make a difference. And again, those are people who are in the hospital, because when we know that somebody is positive or negative for COVID-19 in the hospital, that will greatly impact the type of care and the precautions that we might need to take in order to care for that person. The reality, unfortunately, is that we're not testing enough people now. We do know that there are more supplies on the way, and within the next week or so, my anticipation is that we'll be able to test more like 200 to 300 people a day. Again, not enough, but we are certainly making some progress. That being said, let's put the test results in perspective. The reality is that we can't judge our success based on the numbers of tests that we're ordering, or frankly, even the results of those tests, because we need to assume that all of us in this community is at risk for conveying this infection to somebody else. We need to all assume as though we have been exposed and that we might get somebody else sick.